Hello, everyone. Welcome to another assessment for our lab students who are applying for their CAA. Today, we shall be reviewing the overview of the nervous and cardiovascular systems. Let's welcome Sir Jobel of Cadiz City. Good evening, Sir Jobel.
Good evening po sa lahat din po. Good evening po, Doc.
Good evening. Okay, so what is this po? Consists of brain and spinal cord.
Central nervous system po.
Okay. Then this is how the central nervous system uh, looks
Yes.
like and what it consists of. No? Okay. What do you call this? Consists of nerves extending from the spinal cord and brain to to the muscles, intestines, and the skin.
Uh, Peripheral nervous system po.
Okay, so this is the
Peripheral.
peripheral nervous system. Okay. Okay, what do you call the nerves that originate in the brain? And there are 12 of them. What do you call the nerves? Sir Jobel.
Yes. Uh, Cranial nerve po daw.
Okay. So there are actually 12 cranial nerves. No? Okay. What do you call this uh, division of the nervous system, which consists of nerves going to the various organs and smooth muscle, which are involuntary in nature?
Autonomic nervous system.
Okay. The autonomic nervous system. What is the basic unit of the nervous system?
Neuron.
The neuron. Okay, ito po yung structure of the neuron and try to familiarize yourself with the parts. What are sensory projections which carry information to the nerve cell body?
Dendrites.
Okay, these are called the dendrites. Okay, andyan po yung dendrites. Yeah. Okay. This contains the nucleus and the cytoplasm.
Nerve cells body.
Okay, nerve cell body. Okay. So this is the axon. These are the dendrites, the nucleus, and this is the cell body. So the cell body consists of the nucleus and the cytoplasm. Carries the impulses away from the cell body to other neurons or other target tissues.
Axon.
Okay, axon.
Axon.
Ito. Away
Axon.
from the cell body, the axon. Okay, what do you call the junction between neurons where they can communicate with each other using electrical impulses?
Synapse.
Okay, the synapse, the synapse. It's called the
Synapse.
synapse, no? Ito po yung junction.
Yes.
So we call it, there's a cleft called the synaptic cleft, synapse. What are chemicals that help conduct information between synapses?
Neurotransmitters po.
Okay, these are the neurotransmitters, no? Hmm. So we have
Neurotransmitters.
yeah,
Okay.
the adrenaline, the fight or flight, the gamma aminobutyric acid. This is for calming. Then we have for learning, acetylcholine, noradrenaline, concentration, dopamine for pleasure, serotonin for mood, glutamate for memory, endorphins for euphoria. So there are 8 that are listed here. What do you call the fatty covering on the outside of the nerves to help speed up transmission of signals?
Endorphins.
Yes, sir. Ano nang nangyari? Ano to? Parang nag-steady. Parang creepy man. Okay, I think nagkaroon ng glitch sa what is happening. Okay, sige lang. Can we... Okay, rest ka muna, Sir Jobel, ha? I cannot hear you. Parang hindi nagmo-move yung ano mo. Maybe we can request Sir Rachel, who looks very prepared.
Fresh na fresh.
Yes.
Sige. So that one is the myelin.
Yeah. You know, one good thing... Okay, look, compare the myelin sheath or the myelin to the wire, no? Electrical wire. Diba there's this insulator, no? Insulator ba tawag doon? So to help speed up the transmission, okay? So this is particularly important when we talk about multiple sclerosis, no? Yeah. What do you call the largest portion of the forebrain that is important in thinking, sight, smell, and muscle control?
Oh, that's the front one is the cerebrum.
Yes. So, nasa neuroanatomy na tayo, no? So, this is the largest part of the forebrain, the front, no? What else does the forebrain contain, which is very important?
Oh. You have the hypothalamus and the pituitary.
Yeah, so the forebrain contains 2 very important structures, the hypothalamus and the pituitary gland, as we will find later on, no? Pituitary gland is called the master gland. Hypothalamus the is the one that has to work in conjunction with the pituitary. What do you call the ridges on the outside of the cerebrum?
That's the gyri.
Okay, gyri or gyri is plural for gyrus, no?
Gyri.
If you remember, Sir Rachel, when we discussed the scalp acupuncture, we were able to locate the approximate area of the precentral and the postcentral gyrus, di ba? Precentral gyrus, remember the motor area, then this one is the sensory, di ba? Remember? And you seem to like it so much. What are the depressions on the outside of the cerebrum called?
Those are sulcus.
Yeah. Sulci, is the plural for sulcus. So, yeah, the elevations are called the gyri. Sulci or sulcus are the depressions. Okay. What part of the brain contains the cerebrospinal fluid? This is located within the brain.
Ventricles. Those are the ventricles.
Yes. And as you can see here, we have several ventricles. They all contain CSF or cerebrospinal fluid. Okay, this condition is called water on the brain. It can be congenital or it can be caused by injury or infection. So what are we talking about here?
Water in the brain is called the hydrocephalus.
Yeah,
The
so
very
this is very descriptive, no?
that's it.
So here you could see the comparison between a normal ventricle and a ventricle that is enlarged when you have hydrocephalus. So this is the white matter. So we have the white matter and the gray matter. This white matter serves as nerve pathways between the cerebral hemispheres and the other areas of the nervous system. What do you call this?
That's the central, that's the midbrain.
Okay, this is the midbrain. Now, we're done with the forebrain. You have the midbrain. Now we go to the hindbrain. So in the hindbrain, uh, it has many ridges on its surface, and this is involved with balance, equilibrium, and coordination. So
That's yeah, cerebellum at
that's
the back.
cerebellum. So the cerebellum is in the hindbrain. That's the cerebellum. Okay. Okay. So another part of the brain, which contains reflex centers for respiration and circulatory control. So as you can see, this is really in sync with the theory in TCM, no? Remember, the lungs and the heart, they always work together. They're located in the upper burner. And this is uh, under the control of what uh,
This one is the medulla oblongata.
okay. So in the hindbrain, we have two very important structures, no? The first one is the cerebellum. The second one is the medulla oblongata. So medulla oblongata is respiration and circulatory control reflex centers. Okay. So which means that if you there's a point in acupuncture that you have to be so careful, no? So we call it the governing vessel
The
16.
do 20, no?
Yeah, no, do 20 is here. The do 16. Do 16 and so do 20 is here. This is the level of the do 16. So do 16 is in between gallbladder 20, no? So you can actually easily palpate it. So the idea here is not to insert the needle too high. Okay? So dapat you should try to avoid injuring the medulla oblongata. So baka mamaya yung pasyente nyo nahirapan ng huminga. So you need to be also be, be very particular about the depth of insertion. Okay? Not only the depth but the angling of the needle. Okay? So if you're going to read the location of 216 or governing vessel 16, those are you have to be very cautious, no, as to the direction of the needle. Okay. So when we meet on Thursday, no, for hypertension, we're already going to teach you how to needle. Okay. Because there's a lot of points um, on the scalp, no, that can actually help with hypertension. Okay, so what do you call these thick membranes that cover the brain and the spinal cord?
Meninges.
Okay, so if this meninges get um, inflammation, we call it meningitis. So what are the three layers of the meninges?
First one is the dura mater. The second one is arachnoid, and the third one is the pia mater.
Wow. So if we go back to this picture, the pia mater is the innermost layer of the meninges, TAP. Okay, this has white matter on the outside and gray matter on the inside. And
Spinal cord.
yes, also bathed in cerebrospinal fluid. So this is the spinal cord. And if the most significant thing about the spinal cord is when it comes to vehicular injury, no, or when you fall from a high flight of stairs, no, or you fall from the horse, um, the higher the level, the more problematic. Okay. So this is the distribution of the spinal nerves from the spinal cord. Okay, this usually functions as connecting tracks between the neurons or the nerve cells and the brain centers. So
Those are the white matters.
yeah, the white matter. So here you could see that where the gray matter is located, no? Gray matter is on the inside, no? So while the white matter is on the outside. Okay. It consists of neuronal cell bodies, which are the brains of the nerves.
Gray matter.
Gray matter. Kaya nga, if you love detective stories, um, like I remember, I'm a fan of when I was younger, and I had the time to read Sherlock Holmes, no? He would also, ay hindi pala, Agatha Christie's Hercule Poirot, no? A Belgian detective. Um, he would always say, you have to use your gray matter if for people who don't have brains. Okay, so this receive input from the sensory nerves.
Dorsal roots.
Yeah. That is why it is so effective to be needling the back of the ear when it comes to pain. No? Like chest pain, back pain, no? Even high blood pressure, the grooves there. So these are the dorsal roots. So if there's a dorsal root, meron ding ventral root. The ventral
Yes.
root will send out signals. Okay, what do you call this? They send out signals to control motor functions.
You just mentioned that the
Yeah,
ventral
sorry.
roots.
Oo. So ventral roots is motor sa ano siya, um, ventral, sa front, while the dorsal would be sensory. Okay. This is formed from groups of nerves that join together to do a common function after they have left the spinal cord.
Plexuses.
Yeah,
Plexus.
plural for plexus. Um, you might be interested to know that we have such thing as solar plexus, yung mga ganun. Ang dami, no? Okay. This is a type of plexus formed from some of the cervical and thoracic nerves to help innervate the muscles of the forelimbs.
Brachial plexus.
Okay. So the name is so descriptive. Remember earlier we were talking about the muscles, no? Sa upper limbs, that's the brachii. So the same thing with the nerves, no? So brachial plexus is actually a network of nerves. Okay? And they come from the um
Cervical.
thoracic and sorry, and part of the thoracic. Okay, so now you get to picture. Okay? Kaya how intricate our framework is, no? The nervous system. Okay, this is a type of plexus. Okay, actually sa description pa lang you can already guess the name. So lumbar and sacral areas naman
Hmm.
innervate the pelvic limbs, no?
Lumbosacral
Yes,
plexus.
the lumbosacral plexus. That's how uh, intricate the network is. You see? For the lumbar plexus, it has several branches, but you do not have to go into that because all we need to do is needle the ear. Okay, so this is the cranial nerve. If you remember, we mentioned that there are 12. So this is the olfactory nerve. Okay, olfactory means smell. So this is involved with the sense of smell, no motor function. So if
That
you
is the
affect,
group under.
yeah, what do you call this nerve? Of course, it's called
Those are the
olfactory.
group olfactory. Yeah, those are the group of nerves under the cranial nerve number 1.
Yes, that's cranial nerve 1. Hmm. Okay. What number is facial nerve? Facial nerve has both sensory and motor components. And this is the reason why we can feel the sensation on the face, and also the motor. You can make several expressions, no? Expression. So if this gets affected, I'm sure you're very familiar with Bell's palsy. Yeah. Oh. So what is this nerve? What number?
Number 7. Those are the
Yes.
cranial number 7.
So, and acupuncture is so effective here. Okay. So you see, and there are 5 branches of the cranial nerve. So as you can see, that's why muhiwig in the nose. Okay. This is called the vagus nerve. It is sensory and motor function to the larynx. Okay. So if you want to have a very functional larynx, which is called the voice box, then you have to take care of this nerve, no? This also gives parasympathetic function to viscera of the chest and abdomen.
That is still under the cranial nerve number 10.
Okay. So these are the 12 cranial nerves. If you want to memorize them, go ahead, no? Let's go to number 34. Um, this is a part of the autonomic nervous system, which is composed of some nerves from thoracic and lumbar spinal cord, and this is regulated by epinephrine, no? So para mabuhay. So if you had experience in the hospital, especially in the ER, you would notice that to revive a patient, you need to do this. You need to stimulate this part of the autonomics. What do you call this portion?
That's the sympathetic.
Yeah, sympathetic. Okay. Think of it as fight or flight. So if you make use of this all the time, this will create a very um, very unharmonious relationship, no? So the other portion, which is formed from the cranial, okay, it's like this, ha? If the sympathetic is thoracolumbar, ito naman craniosacral. O, di ba? It's like, it's a very good, whoever, our creator really was very artistic. So this is regulated by acetylcholine, dominates most of the time. And yeah, so
That is the parasympathetic.
yes, this is the parasympathetic. So yin and yang rang gihapon, no? Okay, so this is made up of the afferent and efferent neurons. And when you stimulate this, it will produce a predictable automatic or unconscious reflex action. What do you call this?
The reflex arc.
Okay. This is the reflex arc. As you can see, if you apply a stimulus to the eye, no, we have a receptor here. And so just say you see an apple. Of course, everybody wants to eat an apple, especially because it looks good, no? So this is how it works, no? Then you decide. Okay, so we have the sensory neuron there and the motor neuron. This is where you have to grab the apple and eat it. So yun. Okay, so if this is affected, then definitely this will not happen. Imagine, can you imagine nawala na yung ano mo? Okay, anyway. Okay, this is a very peculiar question, but this just goes to show that it is very important to maintain a good blood flow. So we have to always endeavor to have a balance of the chi and blood. Okay, so that means circulation should be of
Optimum.
optimum should be at optimum
Yes.
levels, no?
Yeah,
So chi
best.
and blood, we all know they work together. Without one, then definitely circulation is affected.
Mm.
Because once circulation is impeded, blood clot can
Can form.
ensue, no? It will create blood clots. And so what is the impact of blood clot?
Unfortunately, that it will cause a lot of strokes.
Yes. So this is something, and this is something that everyone should be very aware of, no? That's why when we are able to form the group in Cebu, okay, and also Manila, we would like. I'm very excited about Cebu, diba? It's like behind Cebu doctors, so we have to make sure our protocol is doctor friendly, no? And the doctor should know that we know what we're doing. Okay, are you not excited?
Very excited.
Yeah, I would like to make it the prototype there. And by the way, the convention last Sunday, the other Sunday was quite successful. Um, so we hope to be able to get more people to be interested in what we're doing. Okay. Uh, inflammation of the meninges. So this can lead to paralysis. So can you imagine now you understand why you may have paralysis. So there will be difficulty breathing, or you can be in a state of coma depending on the degree of infection. So this can be both bacteria, this can be bacterial or viral. So
Mm.
what is this?
So inflammation of the meninges and the itis is meningitis. Itis, meningitis.
Yeah. So there are many types, no? But
Mm.
regardless, there's one type that's so contagious, no? When I was still an, a clerk or an intern in the hospital, I've seen a lot of cases of meningitis. So kuyaw kaayo, no?
So sa may
Doc,
kagat.
yung,
Oh, sige, go ahead.
Sige,
Doc, yung po bang TB meningitis nakakahawa?
merong type na nakakahawa, especially if it is caused by meningococcal. Yung Neisseria, it's so
Oh,
depende sa of course viral naman nakakahawa yan eh, pero it's the severity of the how virulent the virus is. Yun.
I
Kaya
see.
you have to have a very good immune system, and um, the meninges should be in good kasi
Good
they really
condition.
attack the meninges. Talagang kaya nga
Mm.
tinawag yan na meningitis. They will attack the brain.
Mm.
Mm.
But
Ayun.
based on your practice, Doc, what are those people usually prone to meningitis? This kind of
Those
inflammation.
Yeah, those with a very weak immune system, those whose immune system was weakened because of exposure to pathogenic factors, yung bang sudden, and then you're so pagod. So stress pa rin is very kuan, no? And also when you live in an environment where um it's not so clean, no? So hygiene pa rin talaga is important.
But the age group, like demographic, usually
Oh,
like
I'm sure I don't know if you remember Madam M. There was one, I think he attended one of my lectures. Oo, naturopath din siya. I even forgot the name. He also, if you compare him, compare his pictures, nagtigulang yun siya because he was hospitalized for 6 months or 8 months. Yeah, so
ang mga demographic and Doc is are old people.
no, he was only 30, 40.
Oh.
I don't see that much sa elderly. Yung pang
Oh. So
uh,
those full age, the working class,
the working
working.
class, the working class. Siguro stress talaga has a lot to do, and you know, uh, ano tawag nito, irregular eating, Okay, so why is the immune system down? Because you have a deficiency. No? You have deficiency. So when you have deficiency, it's so easy for you to be invaded by a pathogenic factor. Yan. Lack of sleep, yung mga ganon. Okay. If I remember the name, I will let you know. Kasi if you compare him, he used to be a model daw. Pero, my God, ang layo na. Kaya this is what happens when you get sick too long. It makes you lose a lot of chi. So what happens?
And
Your immune system breaks down. Yun.
understandable.
No. It doesn't happen in all patients, no. And also when you're when you have too much phlegm, when you have too much, of course, diba, compromise na talaga when you have phlegm. Young deficiency na yan eh. So how else can you know, excited? Any other question? Familiarization lang to ha. Let's just leave that to the yung meningitis. Okay, this one, I believe the cause of this one, the next one is phlegm pa rin, which came from dampness, no? According to some Chinese books, phlegm can cause more than 100 diseases. So if you have this as a result of the phlegm, this can cause seizures. Actually, this is a differential diagnosis when somebody that you know will have seizures. Okay.
That one. Those are the tumors.
Yeah, the tumors. And tumors, actually, it still all boils down to a very weak immune system. We actually have natural killer cells or NK cells, no? The problem with most people is, aside from the lifestyle, the usual, they love to eat uh, good food, and then they worry too much, they lack sleep, stress from work, emotional stress. So this will weaken the NK cells, the natural killer cells. And I also learned somewhere that sugar can make your cancer cells happy.
Yes.
And of course, when
There.
you eat a lot of meat, that's why we know somebody here who doesn't eat meat anymore.
Mhm.
Any comment, Madam M? Can you share your
Yes.
expertise?
Share my thoughts about sugar na pagkain siya ng cancer. Kasi ang sugar, as we know, is carbs and oxygen. So, siya yung pwedeng mag-corrupt doon sa telomere part ng cancer cell for it to grow into tumor. Kaya, yun yung isa sa, which is, kung i-base natin sa TCM, well, sugar actually produces phlegm kasi dinadump niya si spleen and then the spleen will produce phlegm. Yun po, yung connection nilang dalawa. So, medically and scientifically, ano sila, coincides. Yun
Yeah,
po.
and then when you find out that you have cancer, you have a tumor, you start overthinking. Di ba?
Combo meal.
Yeah.
Combo na.
Uh, Yun. And I think it's not just the diet, it's also the environment that we live in, no? And even the
Lahat na, lahat na po. Ah, diet, environment, emotional,
Hmm.
mostly emotional po.
Kaya stay happy. That's why ito si Sir Regal, talagang always happy.
Mhm.
Nakapaligo na nga, naka-shower na.
Fresh na fresh. Dapat fresh for me.
Okay. Thank you so much, Madam M, for sharing your thoughts. What about si Sir Sir Jobel? Meron kang gustong i-share? Ano ba itsura ng mga pasyente mo na I'm sure kahit papaano meron kang mga cancer patients?
May
Okay.
may ah, ah,
Ang hina talaga.
breast
Okay.
cancer.
Sige. We'll get back to you. Masyadong problematic naman dyan pala yung internet. Sige. Okay, so much for the nervous system. My God, you
Delay,
can't hear me.
delay kayo.
Parang putla po. Ewan po daw.
Okay.
Ewan po.
Sige. Wala agad ako naintindihan. Baka naman yung aking hearing. Okay.
Yung
Okay. Sige na. Share mo na lang mamaya. Now let's go to cardiovascular system. What is the major function of the cardiovascular system?
Mainly for transportation.
yan na po ba? Yung ibang pasyente
Delay kayo.
Hindi po namin kayo marinig, sir. Ano, parang masyadong carcinogenic yung ano mo signal. Okay. Pagkatapos ng kumain, naging ano na yung signal. Okay. Aside from transportation, what are the other functions?
We have a lot of functions as well for the cardiovascular system. We have the delivery of oxygen and nutrients to the cells and tissues. And they can also remove carbon dioxide and waste products from cells and tissues.
Okay, so amazing, no? They deliver nutrients, oxygen, especially, no? That's why we have the red blood cells to do that, no? That's why they have hemoglobin, which carries the oxygen. And then they are also for removing carbon dioxide. Kaya importante siya. Okay, this is a hollow cone organ which weighs less than 1 pound, about the size of your fist, located in the inferior mediastinum.
Okay. I believe in heart but not love.
Wow. Okay, talaga. Okay. Sige.
Same. Magka-tribute tayo, sir.
Well, I'll ask you
Magka-tribute
for
siguro.
registration fee.
Okay. Mamaya na yan. Okay, this part of the heart is directed towards the left hip and rests on the diaphragm. So
The
that
apex.
means this is not exactly the same what is being depicted sa mga cartoons, no? Yung hindi ganun yung shape ng heart. Yung pag Valentine's Day, no? So this is how it should look like. Nakatilt siya konti. So what do you call that part of the heart?
That's at the apex.
Yeah. And of course, another part will point towards the right shoulder.
That's the base.
And it should lie beneath the second rib. That's the base. What do you call the double-walled sac which encloses the heart?
Oh, this is the pericardium. Actually, I have a lot of questions for the pericardium though, when it comes to acupuncture.
Oh yeah. Sige, go ahead. Ask them now.
No, I just find it interesting because most of the we treat is most of it like the major vital organs, but how come there's part of it, like the pericardium, is only a double sac, why it's just make a major kind of thing for the acupuncture?
Mm. Actually, pericardium is called the sentinel. It's the guardia of the heart. So before the heart is affected, it should affect the pericardium first. That's why it has a double layer, the fibrous part and the serous part. In Chinese medicine, we have the metaphysical meaning and the psychological meaning, whatever, no? So we look at the pericardium as your ability to deal with others. So there are people who are quite sensitive, some are even afraid to socialize, no? And this is rooted um, in your childhood, no? Maybe how you were raised plays a lot in what you can become as you grow older. Okay, take for example a patient I had who had bipolar. He was very young. I think it was in mid-20s. No, bipolar, violent sila pag ano. And then I asked, I really had to dig deeper. And I found out that the mom got pregnant at the age of 15. So the family did not want their neighbors to know it. Pero alam nyo naman, marites sa mga tao. So it's basically the attitude of the mom, and it has affected the child in the womb. Okay, so fear is kidney, and it works in harmony with the heart. Kidney is water, fire is heart. No,
The heart.
heart is fire. Okay, so the fire of the heart should go down to the water, to the kidney, to warm the kidney because the kidneys don't like cold.
Oh,
At the same time, the kidney should go up, no? The kidney water should go up to cool the fire of the heart. Okay. So why did the child develop bipolar? So it all boils down to fear on the part of the mother. Makes sense? Because the mother was so afraid that the neighbors would find out. Actually, the neighbors found out.
they will always be. They will
Yes.
always.
So, pero the questionable thing there is because she was so in love. And I remember the younger brother was only 1 or 2 years younger. No? So sa ato pa, she got pregnant again. Or probably they decided to get married early. Yun lang yun. So, the emotional status of the patient, of the mother while pregnant is very, very important. Okay. So if you worry too much, if you're afraid of that people might find out you were pregnant, this can affect the fetus. Okay.
Hmm.
So yon.
That's question though.
Okay.
So as you mentioned, like it really affects the pericardium. So in theory or technically, we can um hit those points in the pericardium and change the mood of the patient. So let's say, for example, the mention that the patient is so scared,
Yeah.
feared,
Mm.
and then anxiety. So
Mm.
if they go with us, we can technically hit the points for the
Yeah.
pericardium, change their mood. Even they're still suffering, but we can technically change their mood.
Mm.
Possible.
It's not just trying to like a patient who is so afraid. So we would expect the kidneys to be affected, no? Di ba, ihi ng ihi. You don't need to really just treat the kidneys alone. You also have to treat um, the mother of the kidneys, which is the lung,
Mm.
you know? this is what's exciting about TCM. The approach is holistic, no? It's so encompassing. Um, that's why if everybody, I think you fell in love with the five element theory, no? I think the same thing with no, with Madam M. She is so enamored with the five element theory. In fact, there is such
I
thing as
do.
yes. It just makes a lot of sense. It's just that you need to tell the patient or uh, educate people that the mind is really connected to the body and the spirit, no? Body, mind, and spirit. And if the kidney is the one that stores your essence, when you say essence, it includes what you inherited from your parents, and that's something that you cannot change. However, when you're on your own, when you're out of your mom's womb, you will have to depend on what you're eating, no, and how you were brought up. So this is to replenish the essence, yun. And it's actually called the fire, and that's what we call the fire of the gate of vitality, to keep things moving, which is actually located in your do four, no? If you are going to locate the navel, just opposite that would be the at the back would be the do four. You need the fire to make things uh, move, no? And at the same time, you need the yin to be able to provide the nutrition, the bone marrow, naman, the brain marrow. The bone marrow and the brain marrow is what they call marrow in Chinese medicine. So still the balance of yin and yang. And not too many people know that um, your kidneys have a lot to do with what is going to happen to you in the future. So this is where we see the connection between the essence, so the jing and the qi. The qi is the functional activity of the zangfu of all the organs in the body. And the most subtle of all would be the shan, no, or the spirit. Okay. Um, and I think you already know by now that the shen should be housed by the the yin or blood of the heart. So how can that happen if there is a problem with your chi? Diba? Hindi siya balanced. Okay? That's why we see people who can't seem to decide fast. We see people who are having issues with sleep, no? And there are several types of insomnia, but that's another story. So going back to your question, we can actually treat in fact, pericardium is a fire element. It works in conjunction with the liver because they are called the Jue Yin, the terminal yin. And if you're going to talk about the interiorly, exteriorly related so-called organ, the Sanjiao, which is the irrigation, no? Your Sanjiao out actually carries your primordial chi, no? It it helps. It's actually called the interstitial fluid, but it has to pass through the upper, middle, and lower burner. Ganon. So yes, we can actually do something about it. That's why when we our course in LAMP, we are very, very particular about the point categories. No, um, I was able to find a book. Did you like the book, Madam M? The latest discovery. Oo, I want,
Sure.
yeah, which one? Yung
Sure
ano ba
po.
title? Yeah, it's a very good handbook. Now I was correct, no? Because you need to know the five shoe points, the back shoe, the front move, the luo
Yes.
connecting.
Yung
The
8.
Yuan source points, di ba? What else? Even
Yes.
the window of the sky,
Divergent.
the influential point.
And entry and exit, mga ganun po.
Yeah, entry point, exit point. Diyan papasok ngayon yung mga the importance of the extraordinary vessels then. Yun. Of which
Yeah. Oh my gosh.
Madam
Yung
M is
EOB,
an
yan po yung
expert.
gusto kong
No? No.
ma-master.
So,
EOB plus yung 5 elements.
yeah. I have several books on five elements. Yabang, no? I'm
Yes.
still searching. Kaya, Sir
Yeah,
Joe,
naku, thank you so much, Doc.
thank you, ha. Ito si Madam M, pati si Ma'am Trixie. Madam M has already finished her Module 1. She was one of the best students in her batch. Minsan nga nakakatakot yung questions niya because we also commit mistakes, no? So I think I found another Madam M in Cebu.
Naku, even terror. I sense.
Oh. And look at how he smiles. Chill
Okay.
lang talaga tayo, no? It takes time for you to really immerse yourself in the philosophy of Chinese medicine. That's why I always tell the students to focus more on diagnosis because I believe that is the only thing that will make our colleagues in medicine to like us. No? So far kasi parang hindi nag-move forward, no? Kasi the approach kasi like I don't believe in short uh, yung mga pinag-a-attend mo, Sir Jobe, yung mga shortcut, no? I don't think it can make you a good clinician. Aside from the continue, that's why nga itong webinar natin, yung the ones I do, no? It's supposed to last only during the pandemic, but sabi ko parang there's still a lot to learn pala, no? And I was able to meet another good friend of Madam M, and who realized that they were connected pala in another dimension. My worst critic, si Ryan Baldomero. Oh my God, wag mo talagang bubudulin. He can tell if you don't know anything. Huh? Oh, sabi niya, if you don't look at the tongue or feel the pulse, you're budol. Ano? You know how he learned acupuncture? Pabaligtad, ha? Oh, ibigay mo yung point. Say, GB37. He will research talaga. Paano yun, ganun. And he would see the connection. Ang bilis niya magbasa. And he graduated recently lang. Okay? So thank you, Sir Regil. No? I hope, I like questions like that, no? Hindi yung puro lang tayo memorize ng memorize. When we have a big project talaga. I would like to work on mental health, no? Oo, kasi ang dami na talaga. I think it's a very relevant topic. And sige lang, if I had the time, if I have the time, I will share with you my 5 element books. Okay? Sige, let's move forward. What do you call the loose superficial part of the sac that helps to protect the heart, anchors it to the diaphragm and sternum?
Fibrous pericardium.
So the next one is serous, no? It is deeper sa fibrous pericardium. In fact, it has both parietal and visceral pericardium. So this is what we call the serous pericardium. Ako na lang sasagot. What do you call the outside layer that lines the inner surface of the fibrous pericardium?
Parietal pericardium.
Tingnan mo, ang dami niyang layer, no? And did you know na ito siya May fluid pa yan dyan. Ha? Para hindi siya magdikit. Because the moment magkaroon ka ng infection dyan, no? Pericarditis, that's going to be bad. Okay? Next to the heart, it is also known as the epicardium. It is a connective tissue layer.
The visceral pericardium.
Yeah,
I
kaya
have questions.
yes.
How about those people who have the cardiomegaly?
Oh, they have cardiomegaly for a reason. Okay. So maybe what you would like to ask is, why would people have cardiomegaly?
Yeah,
When you
absolutely.
have cardiomegaly, it is actually a compensatory mechanism on the part of the heart. No? Why? Because, for example, let me take a look at this one. You have the artery here. We have the veins, the arteries. No? If one of the vessels get obstructed, so what will happen to that area? Let's say dito. This will not receive any blood supply, right? So the
Red blood.
body will try, the heart will try to compensate. It will make itself big. So there is a reason bakit siya lumalaki.
So in short, the heart is already damaged before they have the cardiomegaly.
Yes, there is
What
already a
what
cause.
can as what can I add is ang body natin kasi merong tinatawag na defense mechanism. So, for example, if we have this depletion ng hemoglobin, so what will happen is the heart will pump twice as fast as it can para makapag-supply ng oxygen sa katawan kasi mababa yung hemoglobin. The same as kaya siya nagkakaroon ng maraming like cardiomegaly is that siyempre pagka sobrang kailangan sobrang pagod, sobrang stress, pagkatapos nahihirapan siya or sobrang bigat yung kanyang mga dinadalang like physically or emotionally, ang nangyayari doon, ang katawan kasi natin, masyadong nagko-consume ng oxygen or ng other energies which the heart provides. So pag nagdi-deplete yun, kailangan niyang lumaki para mabigyan niya, masupplyan niya yung need ng katawan. So, that's my observation.
Compensatory siya. Um, the body will always find a way to make up for what is deficient.
So if that is the case, that is reversible lang.
Oh
The
yes.
compensatory.
If you're able to remove the obstruction,
Yes.
ganun lang yun.
Okay.
Kasi nga, like this one, no? This is very common if you have coronary artery disease. So that means one of your vessels is obstructed. In Chinese medicine, we call that heart blood stagnation, no? So, aside from the pain, magkakaroon ng dizzying spells yung pasyente. And the sad thing here is, since the body has a tendency to compensate, nako-correct. So, maglalaki yung ano. So, you don't act, I feel better now. No? So, that's why I always emphasize, I always encourage people to look at, the sublingual veins. No? So, let us make that an issue. In fact, after the lecture on hypertension, I would like people to be aware of their sublingual veins. No? 'Cause it's better to be able to know if you're prone to it rather than wait for the symptoms to come out. Kasi most people would think, I'm old na, so it's normal lang for me to have this. That's actually the common but so you just have to deal with it. So, and most of the time, the patient will, after undergoing a complete battery of tests, mga executive panel pa, they are confident, oh, nothing was found negative. But how come the patient cannot sleep? How come the patient's appetite has not improved? No? Bakit ang pangit ng skin niya? So that is something that cannot be remedied by just giving meds. So with acupuncture, with after a very proper diagnosis, you would know how to help the patient. And that is what we want to achieve in Cebu. Remember, nasa likod ng Cebu Doctors siya. May alma mater. O, diba? And yun. Ours is more on preventative. No? We identify those who are prone. And I would like our practitioners to be strategically partnering with the medical people, no? Kasi diba, like if the patient, of course, the doctors, the Western doctors will always request for laboratories. Sometimes they are baffled because bakit negative and yet my patient is not feeling good. So they will refer to us,
Mm.
right? And then as
Kasi Doc,
oh,
hindi po kasi sila aware na kapagka hindi pa umaabot ng 65% yung damage ng system ng katawan ay wala pang lalabas sa lab result.
oo.
Pero kaya 35% pa lang yung problema natin sa system, nakikita na agad sa
Totoo.
sa skin, sa tongue, sa pulse.
Sa totoo lang ang barometers ko niyan, sleep, no? I have seen a lot of patients improve their sleep, no? They start feeling better, and when we request for laboratories, nag-i-improve. I don't touch the meds kasi baka mainsulto naman yung MD niya. I always ask them to go back to their MDs. Buti naman ina-adjust yung dose. And then another is yung glow ng mukha nila, no? Because if your patient look much older after you treated them, hindi siya nag-improve, no? And a lot of people think na as long as they're on maintenance medication, they're off the hook. That's not true. With acupuncture, with the right treatment, that means you have to go to the best practitioner, to the good practitioner who can actually give you the pattern. Just like yung pattern sa hypertension, we shall be dealing with a lot of patterns. No? Tinrindam ko lang siya 5 excess to deficiencies. No? So these are the things that we need to emphasize. Hindi yung puro ka na lang, inom na lang to lower. What do the drugs do? They just lower the BP. Of course, it helps. But what if if we ran out of meds? No? O let's say, wag naman mangyari. Nag-apocalyptic na yun. Wala kang magawa. Diba? So, with acupuncture, we can make the meds work, we can eliminate the side effects, and we can make the patient feel better, look younger, more vibrant, and the sleep, number one talaga yung sleep. Kasi if you keep on waking up in the evening, meron nga ako isang pasyente before, nakapikit na lang talaga siya, basta lang makaihi siya. Imagine niya tulog siya. Can you imagine? Kabuti tulog lang, nakapikit siya thinking na it was sleep. Waking up every 30 minutes? And now he would only wake up once. O, diba? Why? I saw a change in the picture sa tongue. It takes time to actually study the tongue. And also, when you take pictures of the tongue, katulad ni Sir Jobel, hindi sinasabi yung history. Importante yung history, hindi naman tayo manghuhula. No? You have to tell me the age of your patient, ano yung chief complaint, ano yung medical history, no? Ano yung mga, something about the patient that can help us with the diagnosis. So let us clone people to be very good diagnosticians. Okay? Kasi in the future, magiging matalino na ang mga pasyente. They will only go to practitioners who can effect a change in their pulses. Kami kasi ni Doc Ryan, ginawa ko siyang guinea pig. We tried, we balance the pulses first before we treat. No? So, getting to know the pattern is quite a challenge. So pag nag-improve yung pulse mo, nag-equalize lahat, then you can proceed with the real thing. Okay? So I believe that this is the thing that will make the practice of acupuncture move forward, especially when we are focusing on the ear and the scalp. Some people think, ay, that's only ear. No. Actually, kung titingnan nyo mabuti, it's much deep, very superficial pa lang yung knowledge natin. That's why for you to be able to do ear acupuncture, you need to know everything about TCM. Okay? Ganun na ang labanan. And pinaka-importante is your intention mo for the patient to get well. Kasi if you're focused on how much income you will get and then you keep on adding modalities para tumaas yung, it will never work. Okay? So yun. Even the way you hold the needle, no? The way you talk to the patient, it is a lot. Okay? Okay, let's continue. Slippery lubricating fluid that fills the space between layers of pericardium.
And those are the pericardial fluid.
Okay. Okay. Would you like to rest? Can I call on? Thank you so much, Sir Regil. You may ask questions pa. I know you love asking questions.
That's my favorite sport.
Buti na lang mayroon dito gasagot. Sana all. Sana lahat ng mga nag-ano. Kasi I like people who ask questions. Can I request Sir Harold? Sir Harold,
And I love answering.
gising pa kaya si Sir Harold?
Good evening, Doc.
Yes, good
Good evening, everyone.
evening. Oo, pwede ka.
Na-late ako.
Yeah.
Na-late ako ng pagpasok, Doc.
Alam ko, pero okay lang. Sinagot mo naman yata ito. Okay. Okay, yeah.
Anong kwento, Doc, sa nervous cardiovascular 1 or 2? Hindi.
1.
Wait sa Doc, ha?
Okay. Sige, let's continue, Sir Raja. Let me know when you're ready.
Sige.
Okay, what do you call the middle layer of the heart that contracts?
C1.
Myocardium.
Yeah. From the name alone, you would see, tingnan mo, ang ganda din talaga, no? Myo means muscle. Cardium, the heart. So this is the one that pumps. Okay? What junctions does the myocardium contain?
First, we have the tight junctions, that is bind cells together. The second one is we have the gap junctions that allows ions
Yes.
to flow in cells.
Yeah. Yin and yang pa rin. What do you call the inner layer of the pericardium, of the heart? Okay?
Inner. Inner.
Endocardium. Okay. It helps the blood flow smoothly through the heart. Kaya meron tayong tinatawag na endocarditis, no? Myocarditis, pili ka. Okay. These are called the superior receiving chambers. They receive blood from the veins of the body, and the two areas are divided by the two chambers are divided by the interatrial septum. Sa name pa lang, very giveaway na to. Oh. Interatrial. What is your answer?
Atrium.
Okay. Siguro naman, by now you would know bakit blue ang kulay nito. Ito, pink or red, no? Okay. What about the inferior discharging chambers? They are thick-walled.
Ventricle.
Yeah, the ventricle. They are thick-walled because they have to pump, no? They should pump. Okay. What carries blood towards the heart?
The veins.
Okay. This is called the pulmonary circulation. What receives oxygen-poor blood from the superior and inferior vena cava, which are the largest veins of the body. So this is the right atrium, ha? So we have the inferior vena cava. Ito pala. and the superior?
The right atrium.
Yes, right atrium. Kaya ito yung kulay niya, wala ng oxygen, no? Next, where does blood pump through from the right atrium?
Right ventricle.
Okay. There's a valve called the tricuspid valve. From the right ventricle, there's a valve. Okay, what is the purpose of the valve? To keep the blood from going back.
Going to
Yes.
oh,
Kailangan forward lang siya. 'Di ba? Para bang one way lang, no? One way lang siya. To the pulmonary artery or the pulmonary trunk. What does the pulmonary trunk split into? Like this one.
yeah, the pulmonary arteries.
Yes. Where does oxygenated blood return from?
Pulmonary veins.
Okay, so pupunta siya sa lungs for carries blood away from the heart.
Arteries.
Yeah. So this time we go to the systemic circulation. What do you call that artery which supplies the upper limbs?
The left subclavian artery.
Okay. What artery supplies the brain?
The left common carotid artery. Carotid artery. Carotid artery.
This one,
Carotid. Carotid artery. Yes.
left common carotid artery. So if you
Taon mo
want
ko
to make sure na maano na yung brain niya, you have to really hit the left common carotid artery.
Sorry, Doc. Nagkaon mo ko carrot karon ko doon.
Oh, I love
Panihapon na.
carrots. Okay. What supplies the face, arms, and brain?
The brachiocephalic trunk.
How many valves are in the heart?
There are four. Two for atrioventricular valves, and the second one is we have the two semilunar valves.
Great. Okay, this valve is located on the left side of the heart, consists of two flaps or cusp of endocardium.
Bicuspid valve or mitral valve.
Okay. So why is it called bicuspid? Because there are two flaps. No?
Yes.
A very common problem is the mitral valve prolapse. Okay? So that means there is something wrong with the mitral valve already. Nasira na siya. And there's a reason there. The person had rheumatic fever that was uncorrected in the past. Strep infection, strep throat. So weak immune system or improper medication. Located on the right side of the heart, consists of three flasps. Kaya tawag dito is?
This is tricuspid
Yes.
valve.
Kaya three flaps yan. Okay. These are tiny white cords which anchor the valves in place. The valves open during heart relaxation. They are closed during ventricular contraction. What do you call this?
Chordae tendineae.
Yeah. Located at the base of the large arteries, leaving the chambers found between the ventricle and artery.
Semilunar
And
valves.
these are the pulmonary valves. Okay. Branch from the aorta to supply the heart muscle with oxygenated blood.
Coronary
Yeah,
arteries.
coronary arteries. They drain. When you say drain, hindi na yan artery, no? They drain the myocardium of blood.
Cardiac veins.
Okay. A large vein on the posterior of the heart receives blood from cardiac veins, empties the oxygenated blood into the right atrium.
Coronary sinus.
Blood flows from the right side of the heart. Okay, this one you have to know, no? And back to the left side of the heart. Okay? Kaya, I have a question. Bakit may valve ang vein?
Which one?
The veins have valves. Bakit yung dugo dito hindi bumabalik dyan? Di ba aakyat yan?
Oo.
Yeah, why so?
Because if the blood will be like if going back to the where it goes, it mixes man. It creates a lot of pressure for me. I don't know.
No, there is something in the veins. It has a one-way valve. No?
Yeah.
One-way lang siya. Paakyat lang lahat. And that's how perfect it is.
But there's a cases of that, doctor. The blood will backflow.
Yes. Yung mga venous insufficiency. That means their veins are so weak.
So that means that they cannot breathe anymore. They die.
No, before there is such thing as early stage pa naman. So there is always a possibility that they can have a heart problem later on. But these things happen. Another example would be that's another story, yung tinatawag na deep vein thrombosis, no? But that's another story. We'll talk about it later, or maybe next time. Blood flows from the left side of the heart to the body tissues and back to the right side of the heart.
Systemic circulation.
Yes. Okay, so siguro ready na si Sir Harold.
Nangita pa ko sa file, Doc.
Ay. O sige, ikaw next time. Sige. How many quarts
Next
of
time
blood
na lang guro ko, Doc.
okay, are pushed through the blood vessels in one day? Excuse me.
There's almost 6,000. 5,600
Liters.
liters. Okay. Yeah.
Grabe, no? 5,600. Yeah.
Tingnan
Assist.
na kung feeling niya. Effort
Okay.
tayo.
Meron din tayong system sa heart, ha? Imagine na, high-tech na talaga. It sets the basic rhythm. This is called the
The intrinsic conduction system, nodal system.
nodal system. What is the SA node?
Sinoatrial node.
It is the pacemaker. Kaya pag nasira yan, your heart will stop. It will not be as efficient anymore. That's why others will have an artificial pacemaker implanted.
Question, Doc, how long that will last, the machine? Like how many years they need to change that?
Yeah, you have to change it. So it's quite expensive. Takes years. There was one who asked me, like, syempre expensive. 4 or 5 years, mga ganon. I'm not so sure. Let's check.
Ang alam ko diyan, sir, may baterya po yun eh.
Yeah, that's why they need to change.
I think 5 years is too long. I'm not so sure, huh? Let's see. Where's my cell phone?
Actually, one of my uncle of that doctor got bankrupt because of that.
Yeah, it's expensive.
Very expensive that they cannot work anymore.
Parang 2 years lang yata. I'm not so sure. Kasi I'm not
Which is quite
pacemaker.
like
At saka anything can happen eh. And you cannot use electroacupuncture baka tumigil. That's why
5 years.
we can needle the ear but not the ones near the heart. But others wouldn't dare na lang.
5 years so, Doc, based on Google.
5 years. I think that was my answer kanina. I'm not just sure.
5 years.
Ang bilis. Ginugol mo na lang sa kaya take care of the heart. What is this? At the junction of the atria and ventricle. So, yeah, the SA node, we also have the
Atrioventricular node.
atrioventricular node. Okay. This is called the bundle of His. So, this is this one.
Atrioventricular bundle.
So, connect yan siya. Okay, so these are here. Spread within the ventricle wall muscles. Grabe, no? Electrical talaga. This is called the
Then Purkinje fibers.
Purkinje fibers. What direction does muscle depolarization occur in?
One direction from atria to ventricles.
Yes,
Balik ito.
SAAP. Three factors that increase the heart rate.
So we have the three factors. Number one, we have the sympathetic nervous system of the autonomic nervous system. The second one, it will also affect the hormones, the epinephrine, adrenaline, and the thyroxine. And the last one, which have the third, we have the decreased blood volume.
Okay, this is what Madam M was mentioning earlier, no? So when you have decreased blood volume, so less blood supply, the heart will try to compensate, so it will beat fast. Okay? Now you know. What are the three factors? Of course, kung ang sympathetic mag-i-increase, the other one will decrease.
So in decreased state, we have the parasympathetic nervous system of the ANS. And then, of course, the blood pressure will go up. And then we have the decrease in venous returns.
Okay. Di ba you have a pharmacy? Gawin nating experimental, ha? When I see you on Thursday, on Friday and Thursday and Friday, you will already be taught how to needle yung short lang, and you have to have both the sphygmo and digital, para we'll see. Kasi we have a technique for, like, we have to teach everyone how to take the blood pressure yung using the manual, no? Oo, kasi that's important. That's included in the lecture. Yun. And also, we try to lower the blood pressure. That means you need to identify the pattern. Kahit temporarily lang. So they will buy all the meds, diba? Okay. Resting heart rate of the fetus.
This one is for the fetus, we have 140 to 160 beats per minute.
Okay. Why
And
is it very fast in the fetus?
they need blood to create those things.
Okay.
No, because they need to, I don't know, maybe because
Hindi.
the baby they still making.
Oh,
So they need a lot of blood for the blood circulation, for the nutrients, for the limbs to grow.
okay. What is the female average heart rate?
70 to 80 beats per minute.
And the men?
And then 60 to 70 beats per minute.
Okay.
Muna heblaron per mi ang mga babae, Dok.
Oo, kaya we need to do something about it. The most challenging part of what we're going to do, the ear lang, and probably some points sa gua siya. That's something that they can do on their own. And also okay, anyway, sige na lang when we meet. I have prepared 5 weeks of it sa webinar. So hypertension tayo. And then after that, we'll take up the metabolic syndrome, the favorite topic of Madam M. Pero ano muna tayo, high blood pressure, because it's so relevant, no? Damage to AV node can partially or totally release the ventricle from the SA node's control. So mawala na siya, no? It results in a slower heart rate as ventricles contract at their own rate. What do you call this?
Heart block.
Yeah. This was what I was saying, no? If a part of the heart muscle is no longer supplied kasi may obstruction, okay, may blockage, so the heart will have to enlarge its size to make up for the, and lack of adequate oxygen supply to the heart muscle may lead to fibrillation.
That one is the ischemia.
Yeah. Ischemia is lack of adequate oxygen supply. Pagpatay na, we call it infarction. mayroon ng cross. Patay na yung um, it's only where pag patay na yung mga tissues, yung ano, lalaki na siya. So ischemia is still something na we can still help, no? Pag nag-infarction na yan, myocardial infarction, then you'll have a heart attack. Rapid uncoordinated shuddering of the heart muscle. So can you imagine, wala na, out of control na? The heart is totally useless as a pump, and this is the major cause of death from heart attacks.
Fibrillation.
Okay. That is why we defibrillate. So pag sa ER pa na siya, if you watch movies na ano, yung mga medical TV series, no? We defibrillate, ventricular defib, no? We try to normalize the heart rhythm. So what do you call the rapid heart rate over 100 beats per minute?
Tachycardia.
Okay. When you see sinus, it's regular. Tanawa, regular siya. Dili pa siya irregular. Slow heart rate, less than 60 beats per minute.
Slow heart rate is a bradycardia.
Yes. Okay. Cardiac output, the amount of blood pumped by each side. So one ventricle of the heart in 1 minute. So
Cardiac output.
yeah, cardiac output. This is the rate of oxygen consumption over arterial oxygen. Okay, this is a little bit technical, but good to know lang ito, no? So it's stroke volume times heart rate. Stroke volume, what the heart pumps, total amount of blood, times the heart rate. That's the cardiac output. Okay, the volume of blood pumped by each ventricle in one contraction. That's one heartbeat. It usually remains relatively constant. This is the stroke volume. Kaya nga tawag dyan stroke volume. Okay? What's the typical heart rate?
Around 70.
Yeah.
70 or 70 to
70,
80.
75.
70 to 80. Yes.
It's 5,250 ml of blood pumped per minute. So that's like 5 liters, no? Wow. Blood circulates inside the blood vessels, forming this closed transportation system. Transports blood to the tissues and back. So that's why it's called this is now.
Vascular.
Okay. Kasi earlier we were talking about the heart lang. That's only the cardio part. Ito naman vascular system. How is blood carried away?
Oh, the first is from the aorta and then goes to the arteries, then arterioles and capillary beds.
In decreasing size, no, of the vessel. How does blood return to the heart? In order.
So it starts with the venules, then goes to
Yes.
the vein, and then
Yeah.
vena cava.
So I think this is easy. Okay. It lines the lumen or the interior of the vessels, thin layer of endothelium. It has a slick surface that decreases friction as blood flows. So kung hindi nagpo-flow yung blood mo, it will get to stick there, especially if your blood is so toxic, ang daming dumi. So
Last name,
you form a plaque. So what do you call this layer?
tunica intima.
Yeah. And then middle coat is called
The tunica media.
yeah,
Media.
media because it is controlled by the sympathetic. And the outermost is
Extrema. Tunica extrema.
okay. This has a thicker tunica media than veins. Kasi when you're supposed to pump away, it has to be thicker. No? So blood is pumped from the heart under high pressure. So dapat thicker ano talaga siya. Thicker walled. So if you want to be specific, the tunica media is thick than the veins. And the veins are collapsible, but it is equipped with a valve, with a one-way valve para derecho pataas. These are arteries. Okay. Only one cell layer to allow for exchange diffusion between blood and tissue. What do you call this?
Capillary.
So you see, artery, arterioles, capillaries, and venules, and vein. Okay. This is where what happens here sa capillary bed. The waste is being discharged, the ano is being absorbed, nutrients. Veins have a thinner tunica media than arteries. Lumen are larger. O, diba? Make sense? Kasi if the lumen is thinner, narrower, so lalakas yung pressure, diba? But this one, it operates under low pressure. So the veins. The largest artery in the body.
Aorta.
It leaves from the left ventricle and moves upward, then arches to the left. This one.
Upward ascending aorta.
This one, kanipani. This is the arch. Ascending the arch of ascending.
Ascending.
Okay. Arches to the left and plunges downward.
Aortic arc.
Okay. Travels downward through the thorax and passes through the diaphragm.
Diaphragm. Thoracic. Thoracic. Diaphragm. Thoracic aorta.
Passes through the diaphragm into the abdominopelvic cavity.
Abdominopelvic abdominal aorta.
Okay. I'm sure you've heard about aneurysm, no?
That's what my wife and my father-in-law died, aneurysm.
Aortic aneurysm.
My father-in-law.
You will only know you have it if ni-rupture na. Kaya dapat bawal ma-stress. Okay. This drains the head and arms.
Superior vena cava.
Drains the lower body.
Inferior vena cava.
Alternating expansion and recoil of an artery that occurs with each beat of the left ventricle, which creates a pressure wave of blood.
Pulse.
Average resting pulse.
Around 70 to 80 beats per minute.
Okay. Pressure the blood exerts against the inner walls of the blood vessels.
Blood pressure.
Pressure at the peak of ventricular contraction.
Systolic. Just the up.
Pressure when the ventricles relax.
Diastolic.
How is blood pressure recorded?
Systolic then / diastolic.
Yeah, millimeters Hg. What's a normal systolic pressure?
Normally around 80 to 120. And for like that.
Yeah. 110 to 140, 75 to 80. But I think there's a new rule now. Pero more or less dyan. The older, other age group, masyado na mataas yung 140. So what is low systolic? Below 110, often associated with illness.
Low systolic.
Hypotension.
Yeah, hypotension.
High systolic above 140 can be dangerous if it is chronic.
Hypertension.
Heat has a blank effect on blood vessels.
If heat, it is kung heat siya mo, expand mo na siya sa vasodilating.
While cold, the opposite.
Kung cold siya, constrict siya, so vasoconstricting.
So if you drink cold water on a hot day,
Cold ka mo, constrict. Pero kung natin ihon guro sila, Dok, no? Kung init guro kayo, no? Makit stroke sa, kung tagagbugnaw na yun.
yes, yeah. Mauna.
Constrict.
Actually, di ba sa China, maskin mainit, they always drink tea, no?
Ang older generation lang, usually ang younger generation, gusto
Wala
uminom magkapatog ng mga cold ba. Pero sa kuan, mga older, akong mother-in-law na ko, asa mo inom.
What is the effect of epinephrine on heart rate and blood pressure?
Increases the heart rate and the blood pressure.
Nicotine causes,
Vasoconstriction and increased blood pressure.
sige, smoke pa more.
Akong papa ano daw, kapit tatigok.
Alcohol. What about alcohol?
Alcohol is a vasodilation, pamparelax.
It decreases the blood pressure.
Pamparelax at
Pero you
pamparelax.
notice, mabilis yung pulse. Napansin mo? Bounding yung pulse.
Wala
Opposite.
po ka dyan.
You tried, ay, okay.
I need someone who's drunk.
Well, si Sir Jobel was smiling earlier. Sympathetic division.
Oh, that is sympathetic. It will increase. And of course, once you increase the heart rate, it will increase also the cardiac output. That means that increased cardiac output will also increase the blood pressure.
Okay. Parasympathetic, sa opposite.
Parasympathetic, relax.
This is what,
Digest and relax.
I think that's how the shiatsu works, no? Yung inaano mo yung sa likod. Taman the effleurage para bumaba yung ma-relax yung patient. The organ which regulates blood volume.
Kidneys.
Yeah. So take care of kidneys. Pero grabe gyapon mo kaugbuan ang mga taga. Okay. The enzyme that is released by the kidneys when the BP is low. It causes vasoconstriction to increase BP. So you see, this is what we mean by compensatory. Like if the blood pressure is low, the kidneys will have to release an enzyme called
Renin.
yes. Now, this is the tube heart, which begins pumping blood. This is the, like, at what age of the embryo? Of the
Fourth week.
fetus? No? Yeah.
Fourth week.
Fourth week. The heart becomes a four-chambered organ by?
The end of the 7th week.
Very good. Hardening of the arteries, in which plaque builds up inside arteries. Okay, the plaque is made up of cholesterol, fatty substances, cellular waste, calcium, fibrin.
Arteriosclerosis.
Most common type of heart disease, leading cause of death in both men and women until now. It happens when the arteries that supply blood to the heart muscle become hardened and narrowed.
Coronary artery disease.
Okay? Pareho lang manili eh. Yeah, the same. Thank you so much. I'm sure tulog na yung mga kasama natin. Thank you very much for joining.